I kind of wrote this down because I get nervous. But as a lifelong Democrat, I was disgusted to see that President Obama continued the Bush policy of trillions of dollars of bailouts to a bunch of criminals on Wall Street. What I find even more horrifying is a healthcare policy that the president himself says is centered and based on something called IMAC, which is in fact the death panels that have been criticized. The death panels are not.
Let's first of all, we don't expect to agree with everything that's said. Let's respect the way somebody say it.
The death panels are not the end-of-life counseling, but in fact they are what Lyndon LaRouche warned of, a Hitler-like policy of rationing medical care. Now, Mr. Congressman, you know very well what I'm talking about with IMAC, because you yourself correctly joined with some 70 other Democrats, so your Democratic colleagues, in a letter authored by Congressman Neal to President Obama, insisting that IMAC not be part of this legislation. For those of you who are unfamiliar with it, the full text of the IMAC bill is on the White House website, authored with a letter authored by Peter Orszag to Speaker Pelosi demanding its inclusion. What it entails is a 5-member board of actuaries that would be empowered to enforce what treatments doctors are permitted to give to which patients and what should be denied on cost-cutting basis. Precisely the HMO model, which the physician that we heard from earlier correctly opposed. Now, President Obama insisted in a July 22nd interview in the Washington Post that this is the one aspect of the policy that is non-negotiable. He has dropped universal coverage. He has dropped the idea of a public option. My question is, why not just dump this fraudulent reform and start over with something real? In particular, along the lines of the bill that you, Mr. Congressman, co-sponsored with Representative Conyers, the single-payer bill, House Resolution 676. Again, thank you.
And after that will be, in terms of the 5-member panel, there is an advisory committee designed to figure out what the basic coverage will be. That a policy cannot exclude, can cover everything but diabetes, no cancer coverage, and full of holes. It'll cover everything except what you got. So there will be basic coverage that's available. It will include wellness care, preventive care. It will include mental health, well-child checkups and whatnot. There will be minimum coverage, and that's what the advisory panel will talk about. The so-called death panels, I think they've been discussed in the public. Some people think they're there. There will be no body telling people. We have an experience already. We have Medicare that's in effect today.
I have one question. Basically, Section 102 says you can keep the policy. It allows a 5-year grace period for employment-based health plans, but there's no grace period for individual health plans. And I think if that paragraph was modified or amended a little bit to allow if current policies meet the new standards, allow them to have continued enrollment.
One of the things we're going to insist on is that the policies maintain a minimum amount of coverage. If policies don't come up, then you got to go on somewhere.
Yes,
Someone's going to make it.
I agree with that.
I wanted to know the difference between public option which I find very good, and this co-op that they're trying to.
I'm not sure what the co-op is. I think, first of all, the public option, if people want to know what that is, I think it would have been simpler from my personal perspective. We would just said people could buy Medicare cards, people would know exactly what we're talking about. They have a co-op apparently in Wisconsin. We've been advised by the representatives from Wisconsin that it is not working very well. Frankly, getting an insurance company to administer the plan would make sense because, you know, whereas you can get employees, administrators, office space, and all that, if an insurance company low bid or something gets to administer the plan, that might work. And so I don't know exactly how it would work. But the idea is it would be a nonprofit, local, state-by-state situation.
I thank you for this town hall meeting. I live in Richmond. Dr. Joseph is my physician. I support this 100%. I am one of the persons who have, over the last 10 years, have had multiple diagnoses, life-threatening illnesses, over hundreds of thousands of medical expenses. Yes, I did have to file bankruptcy. Not proud of it. I have an earned doctorate. It doesn't matter. When you're sick, it doesn't matter. I had to file bankruptcy. I am a grandmother raising my granddaughter. Her premium is high. Right now, she has 4 wisdom teeth that have to be pulled. The copay is $320. It is absolutely absurd. The legislation will be passed. I'm standing on it and believing it. And those who do not support it, they will come on board because we believe that no weapon formed against us shall prosper, and I thank you.